critical problem facing the Tri-Cities region every day. A lack of mental health service urgently needed for people often in the crisis of their lives.
But the impact goes far beyond the patient. Caroline Corrigan found out it's draining the resources for police across the region, dramatically impacting their ability to keep the public safe.
I found out many local law enforcement agencies are having to take officers off the streets and out of schools to transport patients to a facility for treatment. You may think deputies here at the Sullivan County Sheriff's Office spend most of their time patrolling the streets and securing our schools. But if you look inside, you will see that deputies are spending a significant amount of time transporting patients to mental health facilities.
Almost constantly somebody's on a mental transport.
Captain Jeremiah Lane with the Sullivan County Sheriff's Office says the state requires law enforcement agencies to transport involuntary mental health patients from a hospital to a facility for treatment.
In Sullivan County, we have 3 hospitals. We have Bristol Hospital, Indian Path, and Holston Valley. All 3 of those hospitals are located near the state line, whether it's Virginia, all the hospitals they're located near the state line. So we get all those patients that come in from out of state also.
In 2018 alone, the Sullivan County Sheriff's Office spent more than $100,000 on transporting nearly 1,500 patients. And they aren't the only ones. The Washington County, Tennessee Sheriff's Office transported 325 patients, while the Washington County, Virginia Sheriff's Office transported 282. Meanwhile, in Abingdon, it's an issue Police Chief Tony Sullivan has been vocal about on social media.
There's got to be a better way.
He says for their department, the distance has the greatest impact. 6 to 8 hour trips, some as far as Virginia Beach.
We've had to make several changes. We now have an on-call schedule for officers on their days off. If we had a facility closer, there would be a very little impact on taxpayers and law enforcement locally.
While this seems to have a significant impact on the law enforcement agency, if you ask a deputy or officer, they will tell you the real victim are the mental health patients.
There have been children as young as 7 that have been taken away from their parents and placed in facilities 5 and 6 hours away. Put yourself in the shoes of somebody who may have a family member who's in a mental health emergency. Do you want them riding in the back of a police car by themselves 4, 6, 8 hours away and being dropped off for 72 hours? I mean, it's just wrong.
Chief Sullivan says an ambulance would be a better option for patients.
We've stigmatized it, I think, by using the police. I think we've stigmatized mental health as a criminal disorder because of the use of law enforcement to do this. And I think we've actually discouraged people from seeking help because a lot of people know the process.
A few suggestions by law enforcement officers they say would be helpful if more mental health facilities were available, if family members were allowed to take patients to the facilities, and if there was another transportation option. And I'm told several local law enforcement agencies have asked lawmakers for help, but so far no changes have been made.